Did you know that back in 1987, India reported something like over 28,000 cases of polio? Just staggering numbers.
Yeah, it's hard to even comprehend that scale today.
But then, just over 2 decades later, they did something incredible. They got certified as polio-free. It's a massive public health victory.
It's monumental.
So today, on the deep dive, we're going to unpack exactly that. India's really remarkable journey to eradicate polio.
Mm-hmm.
Our mission really is to figure out how they pulled it off, the strategies, the huge challenges, and what really made the difference.
And there's some fascinating twists and turns along the way.
Definitely. Okay, so before we get into the how, let's just quickly level set. What exactly is polio? Why was it such a scary opponent?
Right. So polio is basically an acute viral infection. It's caused by an RNA virus, and it mainly goes for the human gut, the alimentary tract.
Okay, the gut. But the paralysis, that's the thing everyone knows.
Exactly. See, most infections are actually pretty mild, but the real danger, the scary part, is in about 1% of cases.
Just 1%? That feels like more.
It does, because the impact is so severe. In that small percentage, the virus can get into the central nervous system.
Okay.
And that's when you see varying degrees of paralysis, sometimes permanent, and in some cases, tragically, it could even lead to death.
Right. So you've got this dangerous virus in a country like India, incredibly vast, incredibly diverse, millions and millions of children. This wasn't going to be easy.
No, not at all. And it wasn't a quick fix either. The efforts started way back.
How far back are we talking?
Well, initial vaccination efforts against polio in India actually kicked off under the Expanded Program on Immunization, the EPI, way back in 1978.
78, okay.
Then in 1985, they launched the Universal Immunization Program, UIP. The big goal there was universal coverage by 1990.
Ambitious.
Very. But like you said, by 87, they were still seeing over 28,000 cases reported.
Yeah.
It just shows you the sheer mountain they had to climb. And this wasn't just India's problem, right? This spurred global action. The World Health Assembly committed all member nations to global polio eradication in May 1988.
Okay, so the world is on board. India knows the scale of the challenge. How did they start to build a strategy? It couldn't have been just one thing.
No, definitely not. It had to be multi-pronged. And this is where it gets really interesting. The absolute foundation, the bedrock, was routine immunization.
Makes sense. Get the basics right.
Exactly. The goal was simple on paper. High coverage. Get every child under 1 year vaccinated with at least 3 doses of the oral poliovirus vaccine OPV.
The drops, right?
Drops, yeah. The schedule was quite specific. 3 doses, a month apart, starting at 6 weeks old.
Okay.
And they even recommended what they called a 0 dose, giving OPV to babies born in hospitals right before they went home, trying to catch them as early as possible.
Okay, so routine immunization is crucial. But clearly, given those numbers in 87, it wasn't enough on its own to stop the spread quickly. What came next?
That's the key insight. Routine immunization is vital, but it couldn't interrupt widespread transmission fast enough. So they needed a surge. That led to the National Immunization Days, or NIDs. You probably know them better as Pulse Polio.
Ah, Pulse Polio. I remember the campaigns.
Right. The idea was pretty revolutionary for its time. It was about mass administration of additional OPV doses.
The additional, on top of the routine ones.
Yes. To every single child under 5 at intervals of about 4 to 6 weeks. The aim was literally to flood the community with the vaccine virus.
Flood them. How does that work?
Well, the idea is to rapidly replace the wild, dangerous poliovirus circulating in the environment and in people's guts with the weakened vaccine virus. Kind of overwhelm it and break the chains of transmission quickly.
Wow, like a vaccine blitz?
Pretty much. And they refined it too. They developed intensified PPI, or IPPI. That meant setting up fixed booths for vaccination on the first day.
Okay.
Followed by teams going house to house for the next few days, actively searching for any kids they might have missed. Really comprehensive.
Leaving no stone unturned.
Exactly. And later, as they started winning, as the wild virus became cornered in specific areas, they adapted again. They moved to subnational immunization days, SNIDs.
Focusing the firepower.
Precisely. Targeting the endemic areas. And they even got smarter with the vaccine itself, using monovalent oral vaccines targeting just type 1 or type 3, whichever specific type was actually circulating in that area at that time. Yeah. That started around 2006.
Okay, so they're hitting the country with these massive pulse campaigns. They're refining the targets. But how did they know where to target? How did they track this invisible enemy?
Crucial question. They needed intelligence, eyes and ears on the ground. That role was filled by the surveillance of acute flaccid paralysis, or AFP.
Acute flaccid paralysis, that's the sudden weakness or paralysis symptom.
Yes, the system was designed to detect any case of sudden onset floppy paralysis in children under 15, or really any illness that looked like paralytic polio.
So like an early warning system.
A very sensitive one. Every single reported AFP case was rigorously investigated by trained medical officers. Cases were reported off the chain, local, state, national.
And who coordinated all that?
A huge part of making that work was the National Polio Surveillance Project, the NPSP. It was launched as a joint effort with the WHO, specifically for active AFP surveillance.
Okay, so they find a case of paralysis. What then? How do they know if it's actually polio?
That's where the labs came in. Laboratory investigation was key. They collected stool specimens from every AFP case.
Stool specimens? Why stool?
Because the poliovirus lives and multiplies in the gut, and it's shed in the feces, so testing stool is the definitive way to find the virus.
Got it.
These samples were rushed to specialized labs, and they had to get there fast within 72 hours of collection, ideally.
72 hours. That sounds like a logistical challenge in itself.
Immense, especially in remote areas. But it was critical. The labs could then test for polioviruses, distinguish between the wild virus and the vaccine-related virus.
We'll come back to that distinction.
Yes. And they could even map the virus's genetic makeup to see where it came from, track its spread.
Like viral fingerprinting.
Exactly. And if they did detect wild poliovirus,
Immediate
action. They launched outbreak response immunization, or ORI.
Another round of vaccines?
Yep. Extra OPV doses for all kids under 59 months in the affected area, often combined with intensive searches for any other missed cases, stamping out sparks immediately.
And they followed up on the paralyzed children, too.
They did. Every AFP case was revisited 60 days later to check for any residual weakness. That helped confirm if it was truly paralytic polio.
Okay, so mass campaigns, hypervigilant surveillance. What was the final piece of the strategy for when they had the virus really cornered?
That was the mopping up immunization. Once transmission was down to just a few small focal areas, they went in with these incredibly intensive house-to-house campaigns.
Like a final sweep.
Precisely, to break those very last chains of transmission, making absolutely sure no hidden pockets of virus remained.
It's an incredibly comprehensive strategy, layer upon layer.
It had to be. But what's also fascinating and really challenging is how the strategy had to keep evolving, especially as they got closer to zero.
How so?
Well, this brings us to a really difficult issue. What happens when the tool you're using, the OPV, the oral vaccine itself, has its own risks, however small?
You mentioned distinguishing between wild and vaccine virus earlier.
Exactly. I'm talking about vaccine-associated paralytic polio, or VAPP.
Paralysis from the vaccine.
Very, very rarely, yes.
Yeah.
The live weakened virus in the oral vaccine could, in extremely rare instances, revert to a form that could cause paralysis.
Wow, that must have been incredibly difficult to manage and communicate.
Agonizingly so. Clinically, VAPP looked just like polio caused by the wild virus. You needed the lab test to tell the difference.
How rare are we talking?
The estimates were around maybe 4 cases per million births each year in countries using OPV. So, incredibly low odds.
Still, 4 cases or 4 tragedies.
Absolutely. And they found it was most often linked to one specific part of the vaccine, the Sabin type 3 component. The risk was tiny for the child getting the vaccine, maybe 1 in a million doses, and even lower for their unvaccinated contacts.
And there was another vaccine-related issue, too, wasn't there? VDPVs?
Yes, vaccine-derived polioviruses. This is slightly different. If the weakened vaccine virus circulates for a long time in a population with very low immunity, not enough people vaccinated,
Right.
it can actually mutate over time and regain the ability to cause paralysis and spread. These are VDPVs. So paradoxically, the only way to eliminate all polio, including these VDPVs, was eventually to stop using the oral vaccine altogether.
A real in-game challenge. Which leads us to the next phase of the strategy.
Precisely. The Polio Eradication and Endgame Strategic Plan, which ran from 2013 to 2018. This was about tackling all forms of polio.
So what did that involve? You can't just stop OPV cold turkey, can you?
No, you need a transition.
Yeah.
A key part was introducing the inactivated polio vaccine, or IPV. This is the injectable one.
Right, the shot.
India introduced at least 1 dose of IPV into its routine immunization schedule by the end of 2015. Now, IPV works differently. It gives you great immunity in your blood, preventing paralysis.
Okay.
But it doesn't provide the same level of gut immunity as OPV. So it stops the disease, but doesn't stop the virus from multiplying in your gut if you're exposed.
Interesting trade-off.
It is. But IPV is incredibly safe. no risk of VAPP or VDPVs. And it's safe for people with weakened immune systems. Plus, it boosts immunity against type 1 and 3.
And India used a specific type.
Yes, they actually introduced what's called fractional IPV, or FIPV, smaller doses given just under the skin, intradermally, at 6 and 14 weeks. And it worked really well. It gave high protection rates.
Okay, so IPV comes in. What else was part of this endgame?
A huge, globally coordinated event,
Yeah.
the TOPV to BOPV switch.
Trivalent to bivalent? What does that mean?
Trivalent OPV, or TOPV, contained all three types of weakened poliovirus, 1, 2, and 3. Bivalent OPV, or BOPV, contains only types 1 and 3.
Why drop type 2?
Because wild poliovirus type 2 hadn't actually been detected anywhere in the world since 1999. It was eradicated.
Wow, okay.
So continuing to include the type 2 component in the oral vaccine posed a risk, the main risk, actually, for VAPP and type 2 VDPVs with literally no benefit anymore. The risk outweighed the reward.
So the world switched vaccines.
Yes, in a synchronized window between April 18th and May 1st, 2016, countries using OPV globally switched from trivalent to bivalent, a massive logistical feat.
Incredible coordination.
And it meant strict containment protocols. Any labs still holding type 2 poliovirus stocks had to securely contain them or destroy them. Can't risk it getting out.
Makes sense.
And finally, a really smart part of the plan was integration of resources.
Yeah.
Taking all the people, the systems, the infrastructure built for fighting polio
Yeah.
and leveraging them to help control other diseases too, making the investment pay off long-term for overall health.
That's really forward thinking. Okay, so we've seen the strategy evolve. Let's talk about the timeline. How did this battle actually play out on the ground year by year? There must have been ups and downs.
Oh, absolutely. The pulse of polio immunization era, let's call it, from roughly 1995 to 2011, was really the heart of the fight. PPI launched in 95-96, first for under 3s, then quickly expanded to under 5s.
And it had an impact.
A huge one. Remember those 28,000 plus cases in 87? By 1995, it was down to around 3,265 reported cases. Still high, but a massive drop.
Progress.
Definitely. Then in 1997, that National Polio Surveillance Project, NPSP, we talked about, formally launched with WHO support, really strengthening the surveillance.
Yeah.
From 1999-2000, they brought in the intensified PPI, the house-to-house searches after the booth days, really trying to reach every child.
Getting more rigorous.
Yes, and the ambition grew. The National Health Policy in 2002 actually set a goal to eradicate polio by 2005.
Did they make it?
Unfortunately, no. Things got really tough. Cases did drop incredibly low, just 66 in 2005. It felt like they were almost there.
But
then, a resurgence. Back up to 676 cases in 2006, then 874 in 2007, is a real setback. Wild polio just stubbornly persisted in pockets, not just in India, but also Afghanistan, Pakistan, Nigeria at the time.
that must have been demoralizing.
Hugely. But the core idea of NIDs, the pulse campaigns, it was working in eliminating polio from many, many other countries. It proved the concept.
So even with these incredible efforts, what were the specific hurdles they kept hitting in India around that time? Why the resurgence?
Well, several things. There's still big disparities in how well routine immunization was working in different parts of the country.
Patchy coverage.
Exactly. Then you have the huge challenge of social mobility, migrant workers, populations constantly moving. How do you track and vaccinate those kids consistently?
Yeah, that's tough.
Maintaining the cold chain for the vaccines, especially in remote or very hot areas, was a constant battle. And that issue of VAPP, though rare, sometimes fueled vaccine hesitancy or rumors.
So what did they do? Double down.
They had to. Around 2005-2006, they really intensified strategies again. They started using the monovalent OPVs more strategically, brought in even more vaccinators and supervisors.
More boots on the ground.
Yep. Targeted social mobilization, really working with community leaders, religious figures to build trust, setting up special vaccination booths at transit points, train stations, bus stands, borders to catch migrating populations.
Smart.
More engagement from the very top, political and health leaders, and recommending that OPV birth dose for newborns in the highest risk areas. Just throwing everything at.
And eventually, it worked.
Eventually, yes. The turning point, the date etched in history, is January 13th, 2011. That was the onset date of the last case of wild poliovirus in India, in Howrah, West Bengal.
The last case.
A monumental moment. After that, the clock started ticking. You need 3 years with no wild polio cases to be certified free.
So vigilance was key.
Utterly. And on February 25th, 2012, India was officially removed from the list of polio endemic countries. A huge step.
And the final certification?
That came on March 27th, 2014. India was certified by WHO as a polio-free country. A massive, massive triumph for public health globally.
Just incredible. So looking back at this whole epic journey, what were the absolute key factors? What was the winning formula?
If you boil it down, it really was a convergence of critical elements.
Oh.
First, and you can't overstate this, sustained high-routine immunization coverage, keeping those basic vaccination levels high year after year, especially for the under fives. That's the foundation.
Right.
Second, those effective pulse polio immunization campaigns. That pulse strategy, the mass OPV doses, was incredibly effective at overwhelming the wild virus in the community.
The vaccine blitz we talked about.
Exactly. Third, that robust AFP surveillance. The NPSP network was crucial, finding every case of paralysis, investigating it, getting those stool samples to the lab quickly. You can't fight what you can't see.
Eyes and ears.
Fourth, targeted interventions, really focusing efforts and resources on the high-risk groups and areas of the migrants, the underserved communities, setting up those transit point booths. Precision matters.
Makes sense.
Fifth, and this is huge, social mobilization and community participation, getting local influencers, community leaders, religious leaders on board, building trust, addressing fears, improving vaccine acceptance, even when facing misinformation or cultural barriers. That buy-in was essential.
People trusting the process.
Absolutely. Sixth, the strategic introduction of IPV as part of that endgame plan. Managing the transition away from OPV type 2 safely was critical.
Okay.
Seventh, having rapid response teams, RRTs, ready in all states, plans in place, teams trained, ready to jump on any potential outbreak immediately. Preparedness.
Being ready for anything.
And eighth, you cannot forget global cooperation. This wasn't just India alone. WHO, UNICEF, Rotary International, the CDC in the U.S., their technical support, funding, coordination were instrumental.
The global team effort.
Definitely.
Yeah.
And finally, it's worth mentioning the virus itself. Polio has some unique epidemiological factors that actually make eradication possible, unlike some other diseases.
Like what?
Well, crucially, it only infects humans. There's no animal reservoir where it can hide out.
Oh.
There are no chronic carriers who shed the virus long-term without symptoms. Once you recover, you generally have lifelong immunity. And people with subclinical infections who don't get sick generally don't transmit it very effectively. These factors make it vulnerable to eradication efforts.
So the enemy had weaknesses they could exploit.
Exactly. Which makes India's success even more impressive given the challenges. And remember, as of recent years, only Afghanistan and Pakistan are still reporting wild poliovirus cases globally. India showed it could be done, even in the most complex settings.
It really is an astounding story. Just the sheer scale, the complexity, the adaptation over time. It's a testament to collective action, scientific ingenuity, and pure human perseverance. Taking India from one of the highest polio burdens to being certified polio-free.
Truly remarkable.
So thinking about this amazing achievement, what does it mean for you listening right now? What can we all learn for the future of global health? India's polio journey is powerful proof, isn't it? Proof of what focused political will, adapting science, and really engaging communities can achieve against a terrifying disease.
It really is a blueprint in many ways.
Which leaves us with a big question, I think. As we face new health challenges, and we know we will, how can we take the hard-won lessons from India's incredible victory over polio and apply them to build a healthier, safer future for everyone?